so fun to be on the opposite side of the chair. If you know Dr. Tamara Beckford, then you will know that she is often the one that is hosting amazing guests on her own channel. It's called Your Caring Docs. And I have the fortune and delight of bringing her on to be my guest so that she can share her story and what she is up to today. So if you don't know Dr. Tamara Beckford, then where have you been? But just in case you don't, Dr. Tamara Beckford is an emergency medicine physician, a wife, a mother. She is the CEO of Your Caring Docs and Your Caring Society. She is also a speaker and a self-care extraordinaire. And I love Dr. Tamara Beckford always brings her guests in with applause. And since I don't have the applause, we're gonna hold space for some really awesome effect right here. Okay. Now, welcome to the show, Dr. Tamara Beckford. Can't wait to hear from you.
Oh, thank you. Thank you so much for having me on this wonderful show. I'm excited. I think we've been talking, and a lot of people who don't know, Dr. Jill and I, we hang out, we talk. Whenever we get together, it's like usually hours and hours pass by and it feels like minutes. So we'll try to respect you guys' time today.
You're always welcome to push pause and come back, and I know that this is usually going to be a recurring theme, so we can pick up wherever we left off, I'm sure.
Absolutely, absolutely.
Yeah, so please tell us about yourself. We say you're an emergency medicine physician and we say where you're at now, but before all that, I love your interviews. Before all that happened, can you tell us more about your backstory?
Absolutely. So before all of that, I grew up and I was born in Jamaica in the West Indies. So I grew up in Jamaica with my family, and we moved to the United States when I was around 11. So 11 going on 12, right? That prepubescent stage. Yes, it's
Yes.
very, very awkward phase. Absolutely. So we lived in Newark, New Jersey. And there I went to school. I went to high school in South Orange, New Jersey, this little Catholic high school named Mary Lawn of the Oranges, where it was all female high schools, very small, and our graduating class was a whopping 36
Oh
students.
my
So
gosh.
exactly.
Wow.
So obviously a lot of us who graduate from that school, thank God for Facebook. Some of us are still very connected. From there, I went to high school right there in New Jersey still. And at that point, when you really look at your life, you kind of realize that, like, I still stayed very close to home. I didn't really venture out outside of New Jersey for school or anything. Like, I had the opportunity, but I was just nervous. So I'm like, it's just so many transitions that we go through in lives, right? So
Yeah.
I moved from one country to another during the time when I'm transitioning from kid to adolescent, and then now you're transitioning and you're going to college, and it's just like a lot of people like went off to college in different states, and I'm like, I don't think I was ready for that yet. Now, once we got to the point when it's just like, well, what are you going to do at first? And people, if you've heard my story before, I thought maybe I'd be a pharmacist. And during the time when I was in high school, I would apply for summer programs, and they had the summer programs at the local we have a medical school there, and the medical school had also a lot of other professional schools right there. And I would apply to programs that they had to expose those of us who lived, especially in the inner city, to different careers that are out there. We're called, like, pipeline students. So I did the pharmacy program that summer, where I got to shadow and got experience and shadowing a clinical pharmacist. And unfortunately, the clinical pharmacist did not know what to do with the high school students. You're like, well, you don't know chemistry, you don't know all these stuff. So they said, you know what, why don't we help you? Why don't you help us file away these charts? And at that time, the pharmacist department was in the basement, and that's the time of paper charts, and everyone's medical record number is like 11 numbers long, and I'm trying to file them in numerical order, and I was like, I don't know if this is what I want to do. So the next summer I said, maybe I'll try again and let me see what do doctors do since this is what I thought what pharmacists did. And the next summer, I shadowed a doctor and they were interacting with people and they're talking. And I'm like, oh my God, I think this is it. This is what I want to do. So that's my introduction to medicine. And that's what made me decide to become a doctor.
And that's so fascinating too when we think about mentoring people, right? And I always think about
Mhm.
bringing people into the lab and what exposure you give to students, and even
Absolutely.
thinking back to dentistry or in medicine, like the rotations that we're on, why we feel
Mhm.
we're interested in one might have to do more with the people than the actual specialty.
It's the specialty, absolutely. And when you really think about it, because as you mentioned, in medicine and in a lot of jobs overall, right? A lot of people tend to move towards jobs where they feel comfortable being around other people who they feel are similar to themselves, right? So that's when you get that stereotypical, oh, well, this person has this particular personality, so they'll probably fit in with these people in this particular specialty or job or so on, right? Now, of course, there are definitely it's not set in stone, and our personalities, we all have different layers of personalities, and sometimes that's just what we like. So yes, for those of us who are emergency medicine, like I think we have like this rogue type of personality. We're
Mhm.
just kind of, yeah, I think of it like the MacGyver when you're like, all right, what, I figure this out, let's just
Yeah,
get it
I mean,
done.
you do. You got to know everything, right? At least very much to stabilize the patient as quickly as you can, right?
Absolutely. And that's what I call us. We stabilize. That's really something we have to think quickly on our feet. So if you're someone who likes to really sit and pontificate and, get very, very into the details, then you become very nervous, you become stressed, and then the emergency department end up like not being the specialty for you, and it might not be the department for you. And that's, like you said, that's exactly why we have rotations, right? For you to just go in and decide, because in your mind going in, you're like, oh, ER looks great. I love the show. It looks really fun. And then when you're actually rotating, you're like, I cannot stand this. My sleep schedule's off. Oh my God, what are these people? Why are they still so happy? I don't understand. I can't wait to get out of this rotation. So that's why exposure is so important in anything that we go after in life.
Yeah, and when you were in medical school, did you feel emergency medicine was always it, or did you have some other options that you were exploring?
So I went in. Luckily, I did get to my undergrad year. I got exposed to emergency medicine, and that's when I fell in love. I didn't even know this specialty existed, and I said, oh my God, this is cool. So I rotated and I loved it. But then entered into medical school, I said that I know I like emergency medicine. However, I want to keep my eyes open. I want to keep my options open because I recognize that this is a specialty, and whatever it is, you know how it is in medicine. Once you're training towards something, it's a very long road and you put in a lot of hours and a lot of time, years into your training. So I wanted to ensure that I made the best decision for myself. So I went in with my mind open. I liked the OB rotation. And then by week 4, I'm like, okay, alrighty, I need something different. I need something different. And that thing that goes along with our personalities in emergency medicine, where we like a lot of changes. We like it quickly. We like resolution. We like helping, and then we like really that process where we can like close out our relationship, but in a pleasant way with the patient, either through saying like, okay, well, I'm glad that everything's fine. I made you feel better. Or, hey, I'm going to transition you to my colleague who's going to take excellent care of you, and you're going to get your surgical procedure done because it's an emergent issue, such as appendicitis or your gallbladder needs to be removed at this time. You help, you see, you diagnose, you help, and you transition. So those are the things that brings me a lot of pleasure and why emergency medicine made sense for me.
Yeah, and in watching your lovely interviews, it seems like you're quite extroverted. You're definitely a person. Is that an accurate perception, or how would you describe yourself in terms of introverted or extroverted?
often thought about that, you know, especially now. Now, talking to people, interviewing, oh, I get more and more energized. And, you know, that's the definition of an extrovert, right? You're there, you get energized during that process. After I'm finished, however, I do feel like, you know, the energy drops and I need some time to myself, which is another part of the introvert's process. So I think that I really have to just consider myself an ambivert because I love solace. I love my alone time. You know, it's something that is very, very important to me. I can lay down and look at the ceiling and think about things and, you know, which is good and bad. And you start going too much into
Yes.
your mind.
Mhm. Yeah,
We
the
know there's some
existential crises are on the ceiling sometimes.
yes, absolutely. Like, oh no.
Oh, yeah,
Oh, yeah.
especially as an emergency medicine physician, you deal with quite
Mhm.
a lot of things that can be
Absolutely.
traumatic. And I would
Yes.
love to kind of dive into the things that you have created with your caring docs, with your caring society, and with your devotion
Mhm.
to self care. Can you talk more about how that all started to develop for you?
Absolutely. You know, as you mentioned, emergency medicine is a specialty where you see a lot, and sometimes it's one of those specialties that it really brings your mortality right in front of your face because a lot of the changes that happens in someone's life, some of it they didn't expect that morning, you know? So during that morning, they got up, they felt fine, and boom, either an accident happened, changes their lives forever, right? They feel fine, but they're not sure what's going on inside their body that's been going on for 5, 10 years. And boom, you show up and your life's changed, right? You know, have this very, very high blood pressure. And we know blood pressure is like the silent killer, right? And boom, your life has changed just like that. So after a while of just consistently seeing this, it can take a toll on you. And I'll say that for the first around by year 5 out of like just working, like, you know, not during training itself. So if you included training, it'll be like 8 years. But
Mhm.
at that point, you know, it takes a toll on your mind, and then you start to wonder like, wow, am I next? And you know, we go through these things, we see our mortality, we're getting older, you're seeing consistent just probably patients who are in such dire straits, you know, their kidneys are failing and so on, so that takes a toll on one's mind. Now, during that second, I've been practicing for like 12 years outside of training. So with training, that's 15 years. So it's
Mm.
15 years of just like consistently seeing a lot of things. So I'll say during the second 5 years, so that's between year 5 and 10, you know, you get to that point where you're looking for additional meaning, but you don't really know where. You know, you're doing what you love, but you know that there's probably more out there for me, but you don't know where to look for it and so on. Now, during that part of my life, there are a lot of things that, you know, changed. Like you know, I had children and so on. And yes, they bring me joy, but I feel like I can give more, but
Mm.
I don't know how. Does it make, I don't know if it makes sense to some others, it probably wouldn't. But for those who make sense to, yes, you'll just leave a comment with,
Mhm.
you know, Jillian and let her know, like, yeah, I understand what you're
Yeah.
talking about. So now, you know, we are heading to that point when, okay, I'd like to do more for that I probably have more talents that I don't know that are hidden. You know, I love what I'm doing. I am a doctor, but a doctor is my profession. It's not the end all and be all of Tamara. You know, Tamara has some things that I probably have hidden. When I do these videos, when I'm like, what is it that you really liked to do before you started doing that?
Yeah.
Like, I'm speaking to others and I'm speaking to myself. I'm like,
Mhm.
what is it that I liked doing? Now, when the pandemic hit, there are so many changes that went on. And I really looked within and said that how can I find some comfort and solace and build myself up? You know, as I would say in some of my speeches, like some people looked outward and they started getting Pelotons and they were working out and they're like, yes, I'm going to look and, you know, I want to have this new body by the time the pandemic ends. I started looking inward and I said, well, what are some ways that I can build myself up because I knew that what I was doing, like I wasn't getting fulfillment from it, a total fulfillment, So my pie, I probably had a 66% fulfillment in my pie. Where can I get that other 33%?
It's
And
only
that's
good to have
when
66%,
yeah,
right?
66% is good. I mean, I had my job, I have a loving family, I have, kids, and it took a while for me to be able to have children. I had a challenge in having children, but then now it's here and you thought, well, maybe that'll be it. And then my career is going well. So yeah, 66%, yeah, I'm doing good. But I know that there's probably a
Yes.
little bit more. So once I started working inward, and that's when I started recognizing, wow, that's self care, building myself from the inside out. And I said, how did I do this? And that's when I recognized that I placed it into three categories, my mind, my body, and my spirit. And once I started looking at what I did in those categories, I realized, like, wow, I feel great. And I realized that, wow, not only am I feeling great, but the burden of some of the burden within my life was greater during that period of time. But I felt better than I did the
Mm.
prior 10 years when I had less stress. So my stress the prior 10 years were, okay, go to work and come home for the first 5 years. I was married and so on. And then I had kids, and I said I had challenge. So I had difficult pregnancies. I was on bed rest for most of my pregnancies, for like almost like, I think for the second pregnancy, since my son was 19 weeks, I was on bed rest from 19 weeks and I delivered at 35 weeks. So those are some of those challenges, right? And then, now I go back to work and I'm feeling good, but then I know that there's more. So I'm like, those are the challenges that I had. And then we had the pandemic hit. So I have, two young children, a
Mhm.
3 and a 1.5 year old. And, I'm still married. I have my family in New Jersey. My parents were living there. My mom's a respiratory therapist. So
Ooh,
during the pandemic, yeah, they didn't have enough equipment. So, the stress of like, I hope that everything's okay with her in New Jersey and I'm down here. But then I started working on myself from the inside out, and the stress level was less than the prior 10 years when I had less things on my mind. And I said, how is this possible? And once I figured that out, that's when I started telling people, you figure something out and you want to let everyone know, like, hey
yes.
guys,
Yeah.
look, this is so powerful. These are just some small changes and they're having such big impact. And it's helping me when, I'm in the ER and I'm having to deal with COVID patients and wondering, am I bringing COVID home? And am I doing this? But then I have this level of calm throughout this process. So it's
Yeah.
been an amazing journey.
That is incredible, and I love where you're sharing it on the internet. Of course, we'll go ahead and put the links below. And we talked about your speaking, which I think is you're just starting off, and I can't wait for people to find you because you're going to be such an asset to many people that get the opportunity to hear you and this message. Can you share a little bit about where would where do you envision being the best speaking places for you, or how can people find you to request you to be a speaker?
Absolutely. The aspect of self-care, when we talk about it, it's so important in all aspects of life, right? And so I always mention that in corporations, thinking about self-care for your employees, it's just so important. It increase retention and it boosts productivity. So for conferences, wellness conferences, of course, but also in all the industries. Like if you're in the finance industry, education industry, if you're an HR manager and you're putting together a workshop or you're looking for workshops to put together on self-care, I'd be a great asset to you because all of these small techniques that I've been able to develop as an ER doctor in
Mhm.
the middle of a pandemic, these are just really, really small, powerful tools that your employees can use, and that will help and boost, like I said, productivity for you and for all. And it's not even just with the productivity. I mean, it really will help with coping and dealing with challenges that you'll probably have now and later. For those who are having wellness retreats, this is also a very powerful way. For schools, and also I would really love to get into to also speaking with some of our residency programs. because residency is one of the challenging transition times. If we can teach some of our residents how to develop these skills from now, then it will help them from now on. So once they're finished, their attendings, and they can continue passing these skills on. And it's not just a novel idea. This is a way of life to help to ensure longevity in the specialties.
That's wonderful. And I'm just thinking, a lot of the pushback we get is I would love self-care and I don't have time. And then like with burnout, like self-care becomes a trigger word and burnout becomes a trigger word because we're in systems that don't seem to allow for us to create that time. But as you're mentioning, like one, you're like I would love to hear how you create time in your own life. And then
Mhm,
also like hearing, well, this creates more productivity and I think allows people to really step back and say, well, what am I really doing? Because I often think we're
mhm.
just so busy because society tells us busy, right? Like busy
Busy
is
is
good. You should be busy.
yes.
And, if people know my story, they know residency it became life or death situation for me because I felt
Mhm,
guilty prioritizing anything other than being at the hospital. And like it's been an
absolutely.
interesting year reflecting on that. But certainly we can save that for another day. I just would say self-care would have been a great lesson for me to learn at that time. And I would love to hear
Mhm.
how you incorporate it into your life.
Absolutely. That's a great point. I'll start off also about like in residency. When I was a resident, I didn't think about all of this, and I'll express like I have a thyroid issue and it developed while I was in residency, and I was afraid to tell my directors. I was afraid, my heart was beating like 110 to 20 beats per minute at baseline. And when this came out of the blue, and I said, I was on actually my trauma rotation. And as a second year, and I said, is either I have a PE or I'm going to drop dead, or something's going on.
Mhm.
And but was I still there with my pager, getting that level, trauma activation, running from one end of the hospital to the other, and not telling anyone because I was afraid. So when I finally told one of my attending, he looks at me and he says, you know that there are disability and you have time off built in for these things? And the answer is no. I thought that you just had to just keep going and going. I didn't realize that. And then even like after, if we really think of our mindset in medicine, well, if I'm not here, then I'm going to inconvenience someone else, and therefore I have to continue going, going, going. So now once I started looking at how important self-care was, then I, like you said, try to figure out how can I carve out sometimes. And these are just very small techniques, like I said, that I do, and they have a huge impact on me. So number one, as soon as I wake up in the morning, I do not go on social media. I'm not reading the news. I'm not checking out that text message. I'm not
Just
trying to find out what's going on.
do not do that. Okay.
Yes, do not.
Probably
The
not when you wake up or right before you go to sleep. So
Absolutely not. Absolutely. I mean, the small thing that's so important is that that's such an important part of your day when you wake up, and you're preparing your mind for the rest of your day, right? So you do things that's going to set your mind on a solid foundation. For me, that ground, like when I wake up, I do a gratitude practice.
mm,
I'm
I'm
so
writing this
thankful
down
for.
because
Yes.
I need all honesty, I need to change this
Mhm.
exact habit. And so we're going to use
Yes.
this as a
It
committee.
helps.
We'll follow up in a little while to see how it goes. So yes.
Absolutely. So that's number one. And number two, for me, I do a devotion. Now, for me, I'm spiritual, I'm a Christian. So I'll read on like a passage in the Bible and I'll reflect on it, or I'll read the Bible app. So even though it's on the phone, like I go straight to the app. Like, nope, if you say don't pass go, don't collect $200 on Monopoly, I'm not trying to figure out, because we get all bombarded by so many things I go straight to the Bible app and I'm reading the devotion, and I intentionally do this because I know that once I sit and I read it and I reflect on it and how it would help me in my life and my mind, I start feeling good. And then from that, I personally, if I have the time, like say this, what I just mentioned, that was a good 5 minutes right there, 5 whole minutes. Now, if you have more time, and say if you have another 15 minutes, then I'll read a book. So I'll read a section of a book and I'll time myself if I know like, okay, I have to leave by this time. Then I'll read a book that I'm interested in. Right now, I'm reading Influence is Your Superpower
Mm, I,
by Zoe Chance.
yeah, we got that. Yes, Dr. Sunny said
Yes,
to us. Yeah,
yes,
I'll have to read it
absolutely.
alongside you.
Yes, so that's what I read. But like, it's just 15 minutes, 20 minutes the most that I get in, and then I start my day. Now, once I do that and I start my day is golden. It just really has built, and that's 20 minutes. It's just built up this layer of fortitude that I can go in. And as I like to mention, I can enter into my day and my day does not enter into me. So now when I go and I read that email and it says, oh, you forgot, blah, 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 blah. I'm like, oh, okay. Before when they say, as soon as I wake up, it's just like, why are you getting on my nerves? Why did you even send me this email? Oh my goodness. And
Yeah,
then I'm ruminating all throughout the day. But once I do it that way, it does not happen.
I do that. Yes. So this is another thing. So again, this is the accountability moment, right? I do that
Mhm,
with anticipation of the things that will stress me out, and I do it on repeat. And like,
mhm.
I need to stop doing this, and then I'll get up the next day and do the exact same thing. So yeah.
Absolutely. No, but it takes a while to break that because especially part one is having my phone. So I started, in that I said that I don't pick up the phone as the first thing in the morning or, read those messages. But the preparation for all of that is that I put the phone across the room the night before. So that's even part, yeah, that's the sub part. So I put the
Golden, golden stuff.
yeah,
It's so simple,
absolutely.
and it's the
Mhm.
simplicity of it all that makes it very realistic and tangible to execute in our
Absolutely.
lives.
Yes, because once we do that, and then I started learning. Now, who out there, if for you guys who are watching this and you are a snooze king or snooze queen, you can leave a comment because that used to be me. The
Mm,
snooze button, that snooze button. But then I also trained myself, and that took a while to just once that when that the phone is across, and the phone
mhm,
is my alarm
mhm.
across the room, once it goes off, I get up. That was one of the hardest things for me to do, but now I can do it,
Yeah, because
and it's very powerful.
I remember reading something about like the snooze. Obviously, it doesn't really help that restoration, that
No,
actual
it
increase.
starts back the cycle.
Yeah,
Yeah, the 90-minute cycle for you. And so during that 90 minutes, your body goes back down. And so when you wake up, instead of you feeling refreshed, you're actually more tired.
yeah, I'm
So
always tired. So I, and then yeah, because this is just it's so much. It's the self care and then how you're juggling it all, and it's like I think it is just like what you said, such a relearning. It's like, oh, instead of having that whatever 40-hour work week or what 80 the 80-hour work week of residency, and then we
mhm,
create what we do outside of our
mhm,
regular job, and then it's like
mhm,
now I've just, and this is so common, right? We're like, now I've just
mhm.
created 24/7 work for myself, increased
Yes.
anxiety, increased training, and then how to structure our day like you are so that we're actually saving time for ourselves to rejuvenate and follow
Mhm.
something that's going to not create additional burnout opportunities for us.
Exactly. And that's why I think it's so important because if I come to you and I said, Jillian, which I'd be like, Jill, we need to blah, 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 right? We need one more
Yes, you
hour. You
do.
need to do
The
this. You
first
need to
coffee,
do
the first, even worse, right?
it would
The
probably,
first, I need coffee. You're like, you don't really need it, but like behaviorally, I do. But
yes. But that will add that layer of anxiety.
oh
But
yes,
then
it
if we said,
does.
hey, do you think you have like 20 minutes? Hey, how about when you get up, well, first of all, our snooze button took up some of that time. Why don't we train ourselves from that snooze? And there's a wonderful what's her name? Mel Robbins. She has the
Yes.
5 4 3 2 1. Yes. So she said that boom, just get up, train 5 4 3 2 1. And that really helps in you just preparing your mind and getting up. Now, for those who are snooze kings and queens, I understand. Like I said, I mean, and I've been a snooze queen for like a former snooze queen, I should say, for years. I mean, this is probably like 20, 30 years of snoozing.
Wow.
And then, yes, so then it takes a little bit of time, but then once you do it and it becomes a part of you, it
Just
really
like any other
helps.
habit, right? We learned it all
Absolutely.
for a really long time, and it's funny you say that because I went into surgery because I've always never slept very much. And then I
Mm.
realized like forced sleeplessness is different than only requiring a certain level of sleep because then the hours that I actually needed to be sleeping, I was waiting for the OR. And
Ah.
and I realize it now too is like the days I drink caffeine too late or I sleep less than I need the
Hmm.
next day. It's such a challenge. So
Yes.
I imagine that once we start to get the validation that these new behaviors are, oh my God, like write down how it affects you the next day. Like, oh my gosh, like I actually, I actually don't want to punch a wall right now, or like,
Yes, like
that-
you're right. And that's the thing that's so important when I think it's so important about these routines, especially I call them wake up routines because I know a lot of people like to call them morning routines, but some of us work nights only. So in the
Mhm.
morning, that's kind of like my 6 p.m. So I call this my wake up routine. However, the powerful thing about it is that, like you mentioned, is that it really prepares you to enter your day with a mindset of responding versus reacting.
Yes.
And that's the power of it because now you have controlled the environment.
Yeah.
And that's why I think it's so important. You have controlled the environment. So now you respond to things and you're not reacting to things. So this mind twirling, 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 you're less likely to do that because you're just responding. Okay, this needs to get done. That needs to get done. You're not anticipating, oh, this person's going to get on my nerves. And that person's going to get on my nerves. And if they do, you just respond to them. You are less likely to react to it.
Even, I was talking to Dr. Yu yesterday and we do like a lot of
Mhm.
the shadow work and self, because I'm literally driving my own self crazy because the person that I am anticipating to drive me crazy is not here. And I'm driving myself crazy. And then to learn what aspects of that interaction I was projecting, like my own
Mhm.
frustrations with being reactive, because I like to be calm and responsive. And as you know, I'm full of
Mhm.
energy. So like
Yes.
it provides me the opportunity to be reactive. But I took a mindful provider course in my last job. It was led by an OBGYN who did Tara
Mhm.
Brock and Jack Cornfield, I believe their name, their meditation program. And it's hitting
Mhm.
exactly the point and what a life changing suggestion and recommendation you just provided is especially learning how to be more responsive. Not only does that provide calmness, but I live in Houston
Mhm.
where you may live close to me. And being responsive on the road, it can save
Mhm.
your life, right?
Absolutely.
And it could definitely save you from tickets. It can save you from a lot of distress of driving.
Mhm.
So
Yeah, absolutely. The mindset of changing and I can't recall who mentioned this particular example, but as we talk about, being responsive versus being reactive, especially on the road. Now, a lot of people have road rage. Oh,
mm,
I mean, I'm coming from the Northeast near New York
yes,
City, road
yes.
rage
Oh,
central. And so when we really think about it, if someone cuts you off, instead of you having this heightened level, sit and think, well, maybe there's something that's going on in their life. And once I started flipping that mindset, like that person is rushing, did they get a bad news and they had to get home quickly because someone is in danger or something bad's going on in their life? And maybe that's why they did that. And then, once I said, well, I hope that they're okay, boom,
Mm.
it was a response, not a reaction. And I moved on with my day.
And I
And it
love that
helps.
energy. You have that energy, right? Because there's so many, just being in your presence, especially, is like, oh my God, I just drove here. And then the moment we connect, it's like, it's all fine. Just because,
Yeah,
just it's all fine. We're going to do this and we're going to do that. And like, you,
yeah,
so you live it to give it. And so that was
absolutely.
number two, right? Were you going to share three?
Mhm. Yeah, so we did that. So now the part that's the challenging part now, which I love that you're doing movement, because if
Oh,
you,
yes, I
and
moved a
like I
lot.
said, for all of you guys who are watching this channel, if you ever need a dance partner, yes, that's my girl. Yeah. So movement
Yes.
is such an important aspect. And I love, like you said, with the jitterness. And, I was watching a documentary about like, why is it that we move and we rock? Like my legs shaking. It really goes back to that common response, almost like when we were cradled as a baby,
Yes.
and that just movement just brought us down. So movement gets some of that pent up energy out. And of course, it's important cardiovascular wise, and it's important for our, to oxygen to our brain. We increase the endorphins, and it makes us feel good. But movement is another very important thing. Now I will be honest, I challenge with, that's one of my challenges with the persistent movement at times. And so because of that, and I recognize that, like, I'm not the best at it, then I get help. So I have a coach that helps me to prepare me and to get me moving, so that I can get that as a part of my day, and to get that as a part of my routine. And I see the difference. And I'll also like add, like, movement is very important. And but I know that the mind work plus the movement can accelerate, because I did movements prior to the pandemic alone. And once I added that, what I just mentioned, like even the preparatory and the mind work and the building, blew it out the waters. Much better person overall. So please do not forget to add your mind work to the movement.
Yeah, and everything I was just thinking too, it's because there's so many I love, and I'd love you to talk a little bit about what your caring society all entails. Because the
Mhm,
thing too that was resonating a lot with me is that even the spirituality, whatever it looks for, or that energy, whatever it looks for, because if we get too, I've gotten this where I was too caught up in my
mhm,
mind, and I have a problem with stopping moving. So it's harder for me
mhm,
to stop moving. And when I stopped moving, I was in that existential crisis, which then comes the spiritual component, or whatever that
mhm,
component and energy looks like for that
mhm.
person, because we are human. And if you are
Yes.
well connected with your existential ism, I don't know, even your mortality or trauma or things
Mhm,
like that, it's just like, what would it look like for that person to process that energy and do some of the
mhm,
somatic, I think it's like all the holistic connection of all that energy that would
mhm.
what I've heard that you do. And so tell us about the Your Caring Society. What does that entail?
Oh, okay, wonderful. So the Your Caring Society is a society to help our busy professional women to put their self-care as part of our health and wellness first for at least 2 hours a month without guilt. So the society has been going on since the beginning of 2022. And every month we have either a speaker who's speaking on wellness. And an important fact too is that my last speaker, Dr. Funke Afolabi Brown, was speaking about sleep. So interestingly, so yes, we talked about the
You be
importance of
there.
sleep. Yes. And also with someone who has a very erratic schedule, such as myself, right? So my schedule is very erratic. Like I work nights, as I told you. I have kids and they need to get picked up from school. in the afternoon. And, and also I broadcast, and,
Yes.
I do
Do
a
it.
lot of things.
That was I don't know how. That was the face was I don't know how you do this all, and I'm
I
grateful that you're here with me.
Yes, no, I get this, pleasure. And that's one of the other parts too, right? So I have to recognize what brings me joy. And this is one of the things that brings me joy. So with the society, with the society, we really get to tap into some of that for the women. And you get some speakers that are experts in different fields, in speaking expert about like nutrition or information on that, information about sleep, information about dealing with crisis that occurs in our life, just a lot of varied portion. And in between that, you work on yourself and what's best in your self-care process to help you to become the best version of yourself, because we're all a work in process. And I'd love to also mention that I love incorporating and learning about self-care, that I recognize it is a process and I have not arrived. And there are times when I do have setbacks. And when I have the setbacks, I recognize that I have to work hard to get back up. But when you're surrounded by a community with people who care and are supportive, it's a lot easier for you to get back up, and you get cheered and you get pushed beyond your wildest dreams to really go for the goals that you have set out, or goals that you didn't even know you had. So that's, one of the beauty of being in the society.
And what a great energy and support, because I hear a lot, everyone's feeling so lonely and isolated. And if you're in
Yes.
an institution or a workplace setting where you're feeling trapped, but you really want a supportive community, sometimes it can be that external supportive community that actually helps you identify what's the core reason, like what are the core issues in your job? If is it something you
Hmm.
can tweak and give you that supportive energy to actually work through it, versus to
Hmm.
constantly feel so trapped and deflated, and we have that learned helplessness. So great.
Absolutely.
I appreciate everything that you're creating. I have to
Thank
ask
you.
you the question you
Hmm.
ask everybody else. If you were
Okay.
not a physician, what would you be?
Oh, I love this, So I was doing it last night. I would love to have been a singer. Now,
Mm.
can I sing? Yes. Can I sing well? No.
Oh my gosh, she just let a huge cat out of the bag. We might need to explore the many talents here of
Oh
Dr.
no, I do not sing well at all. I was singing Patti LaBelle. I love Patti. I mean, I love like the 80s love songs of the 80s, the Whitney Houston, the Patti, the R&B. And then also, who I really like to, and I recognize that I brought my stress level down very, very quickly, Bruno Mars.
I love Bruno Mars. Yes.
Yes, he's just so talented. And I love that you can see that he works very hard at his craft, because when he is performing, everything is in sync. I have not seen Bruno Mars mess up. So Bruno Mars, if you're listening to this interview,
We know
Bruno,
you are.
thank you. And we know you are.
Thank you for
We
taking the time out
appreciate,
of your busy day to listen
yeah,
to us.
out of your busy day, a part of your self-care process, listening to this wonderful interview. We appreciate all the hard work that you put it into your craft. It is not gone unrecognized.
That's so funny. So we did a shout out to Bruno Mars and Brene Brown last time. So in case
Hmm.
she's here listening to this again, she can also join us. I think we'll have to create
Absolutely.
some sort of video to
Absolutely.
Bruno
To
Mars.
let Brene know, especially since she's here in Houston.
Yeah,
So, Brene, absolutely.
we love
Thank
you all.
you.
Well, any last words of advice and words of wisdom to the audience today?
Absolutely. So, as I said, self care is a process. It's not something where you arrive. So, once you build up your self care muscle, then you've built up tools within your arsenal to deal with a lot of the challenges that you're going through now, or challenges that you'll have later on in life. And once you've developed those skills, don't keep it to yourself. Make sure you share it with someone else so they can benefit from it also.
I love that. And make sure you comment down below. This community is exactly that. It's a community. It's meant to be interactive and supportive. So we're so great grateful, honored to have Dr. Tamara Beckford with us. We'll make sure to share her information below so that you can connect her and also watch her lovely channel. It's so much fun. Your
Oh.
energy is popping. I don't know how you do it all. And well, until next time, thanks everyone for watching.
Thank you guys.